and everything's smooshed up in like the little jars and everything. And and you're trying to be like, okay, open up, airplane coming in, and baby, and it, okay, spits it out. But the ones that are good, all right, like the carrots and the squashes and the sweet potatoes and stuff like that, all right, baby gets them, and you're thinking, oh, thank goodness, they're eating something. And so what do? You continue to give them a lot of that, okay? And then the next thing you know, the poor little baby's turning orange or yellow or something, and mom's going, ah! Dad's going, cool, and you got all this sort of stuff going on. Go to the doctor, and the first thing the doctor will probably ask is, well, what have they been eating? And it's because these colors that are in those foodstuffs can build up. Kind of cool. It can happen to us as adults. People who might, do a lot of the healthy stuff and they do too much of the yellowy, orangey type of vegetables and everything, they can actually get the orangey yellow tint to their skin. You can either be like, oh, cool, or be like, dude, hold off on some of that food stuff, So it can happen to us. So that is a pigment that can affect the skin color. This is what happens with our melanocytes. And I don't know why, but I just think that this particular structure that gets formed is so unique. If we're looking at a melanocyte, now note that we've got this really nice plump looking cell where in the nucleus we've got our endoplasmic reticulum, our Golgi apparatus, and so forth. And the production of our melanosomes, their product. But note what this cell does. This cell creates these processes, these extensions, and they begin to extend or push up into other cell layers. Now, if you remember, there has to be a connection between those keratinocytes and these melanocytes. So if you notice, what do you kind of notice about these processes that are extending up into the cells and a cell that they encounter? What do you see happening?
They're being eaten.
They're being what?
Eaten like phagocytized.
Okay. We're seeing that those processes that are extending up into other layers, as it looks like that process encounters one of the cells, that piece breaks off and moves into a cell. Does everybody see that?
This is also in the epidermis, right?
This is in the epidermis.
Okay, so like the desmosomes and the hemidesmosomes, they don't protect from like they allow for the melanin to come through.
Because it's a cell process, and really because that's not, because it's going to be at that basally layer, okay? These cells are busy, okay? So as they basically create their little cell processes, see how they're trying to show that it gets incorporated into a cell? See this little piece, this little piece, this little piece, okay? Now remember, these cells are the cells that are going to be pushing upward. So they'll be going from the basally layer up to that cornea. And the goal is having that connection that can occur between those keratinocytes and now a melanocyte. Because this will help give the pigments to the skin. Does everybody kind of see that incorporation? Because the little piece basically moves into the cell. And this little envelope will break down. This little red part, the melanocyte, will now get to encounter the keratinocytes in the cell. Yes, no, maybe? Okay, so contributing to skin color. Now, we've got the pigments like melanin, okay? We've got our keratins, for example. The other part that can contribute to skin color is blood. The blood circulating through the skin. Now, for example, you might get embarrassed. What kind of happens to your face? Well, if we think about the blood coming to it, the blood comes to it, and you blush, okay? You might be nervous, kind of flush, all right? Now, here's something that can happen with blood circulating that might not be good, okay? And I wrote these down because these are the things that can happen based on blood that you'll encounter in the field. Now, is everybody familiar with the term cyanosis? Cyanide. Well, it does, but you may hear the term when you're in the field. You may hear a doctor or another nurse or somebody go, they're cyanotic. If you hear that, drop what you are doing and go help. Because basically, their blood oxygen level is low. And that could be detrimental to the person. They could be dying, all right? So, cyanotic is not a good term to hear with patients, okay? Now, here are some other things that can go with blood in the skin contributing to color. Erythema. Y'all don't have to write these down. I just want y'all to kind of see how many different things that the blood can do. Erythema is where there's going to be a lot of redness to the skin because there's an increased blood flow.
Is that what rosacea is?
Rosacea, I'm trying to remember if that deals with blood flow or the irritation which would increase the blood flow. Rosacea is going to be an irritation on the, that happens with the skin, and it does end up being very red, splotchy, like across the face and neck and so forth, which if it's irritated, that does bring blood flow to it. Now, if they term it erythema in rosacea, I'd have to look that up, okay? Another one, pallor, and that's a term you may hear, okay? Pallor is where we get an abnormal loss of the skin color. Like you see somebody and maybe something happened and it's like, oh my goodness, you know, their face just went white and everything. They've lost skin color, okay? Almost looking like they're going to faint. The cyanosis, bluish skin. In this situation, because you definitely will hear cyanotic, okay? In this type of situation, their lips will begin to turn blue. The ends of their fingers will begin. So this is this condition of losing that oxygenated blood flow to the tissues can end up being something very severe for the patient. Jaundice, I'm sure you guys have all heard of that. That is where you have the yellowing, and it's because something's not going right with the liver. All right, it's the eyes, the whites of the eye will begin to get yellow. It's very indicative of needing to check something with the liver. Bronzing. Now that will come along with something called Addison's disease, dealing with the adrenal gland. Usually you're getting poisoning from something, okay, that would need to be checked unless the patient passes. A bruise, I'm sure you all have seen or have one of those. The albinism is one that deals with it. Vitiligo, has anyone ever heard of that one, where you've got patches of the skin that have lost color? Okay, so those are just some of the things that can go along with how blood contributes to the color of the skin. And some of it is actually clinically significant. All right, if you see somebody's lips turning blue, get them help, most definitely. Now, in those areas where we can have the thickness. Oh my goodness. Okay, take a break. Be back at 9:30. Right?